All right, so today we're diving into some pretty heavy stuff, some really challenging experiences within the VA healthcare system. We're going to be looking at the journey of a Marine Corps veteran, we'll call him Tucker, to try and understand just how complex it can be for veterans to get the medical care they need after service.
And what's really fascinating here is we actually have Tucker's own account. It's their firsthand perspective on all the hurdles they faced. I mean, talk about getting a look into the system from someone who lived it.
Exactly, yeah. So our goal today is to go beyond just, reading a story. We really want to dig deep into the potential systemic problems that Tucker's case reveals, especially for veterans who need specialized care, maybe for more complex conditions.
It's about connecting the dots and seeing the bigger picture.
Exactly.
Sure.
So Tucker served 2 deployments as a Marine between the Gulf War and 9/11. Now, for almost a decade, Tucker was struggling with some pretty debilitating symptoms.
Yeah, and this is where the problem started. Instead of looking for, a physical cause for these symptoms, Tucker was initially diagnosed with a mental health disorder.
And I think that's something a lot of veterans, unfortunately, end up dealing with. It's like the default assumption sometimes.
You have to wonder, right? Like, what's the assessment process like? Are there specific protocols to really investigate physical issues alongside mental health concerns? I mean, these things can be intertwined, but you got to look at both.
Absolutely. And in Tucker's case, there's even mention of abnormal lab results, like things were off, but they were dismissed as quote unquote normal for Tucker.
Which, that raises a big question. How do they determine what's normal for an individual? Are they taking into account individual variations? Or are they missing potentially crucial changes because they're writing it off as individual baseline?
It's almost like you're using that as an excuse not to investigate further, which is, I mean, that's scary to think about.
It really is.
But then things took a turn, kind of good turn. Tucker got to see a neurologist,
Yeah.
a community care neurologist, and this ended up being a big moment.
A turning point, you could say. This neurologist found small fiber neuropathy and autonomic dysfunction, which, and I'm sure a lot of listeners know, these are often associated with autoimmune disorders. So finally, there was a potential explanation, like they were getting closer to understanding what was going on.
Yeah, like a real medical explanation, not just attributing everything to mental health. But here's the thing. This neurologist ended up leaving before making a definitive diagnosis. And even though these findings were sent to the VA healthcare team, it seems like, and this is according to Tucker, nobody really acted on them.
Which, that raises another massive red flag, right? Like, what kind of communication systems are in place between different departments within the VA and between the VA and these community care providers? If crucial information like that is getting lost or ignored, that's a huge problem.
Absolutely. And unfortunately, things got even worse for Tucker. They had a really bad experience with a VA mental health therapist, which actually led to suicidal thoughts. I mean, that's just heartbreaking to hear.
It's a tragedy.
It really is. Luckily, they ended up seeing a therapist outside of the VA, and this therapist was one who finally referred them to an immunologist. And this is where we start to see some progress. Within 3 months, the immunologist suspected an autoimmune disorder, eventually diagnosing Tucker with a severely dysregulated immune system.
3 months, it makes you think, doesn't it?
Yeah.
What's the typical wait time for a referral like that within the VA system? It begs the question, why the discrepancy in speed?
For sure. But this relief, getting a diagnosis, getting treatment, it came at a cost, a literal cost for Tucker. They were paying $500 every 3 weeks out of pocket for treatment because of Medicare's 20% coinsurance.
It's crazy, right? You're serving your country, you're dealing with these health issues potentially connected to your service, and you're still stuck with these huge bills.
Yeah, and it's important to note that the notes from this non-VA care were consistently sent to the VA. And eventually, the autoimmune disorder was service-connected, based on what that first community care neurologist had found. So the VA did acknowledge the link to their service, but only after all this time and expense for Tucker.
This highlights the financial strain on veterans seeking specialized care outside of the VA. Like, what kind of safety net is there for them? What resources are available? And how easy is it to access those resources? The system should be more supportive, especially while they're figuring out service connection and VA coverage.
Absolutely. Now, Tucker had planned to move to California, and they were on a therapeutic dose of IVIG at that point, which is intravenous immunoglobulin, a treatment often used for autoimmune disorders. They talked to their VA healthcare team about this move and specifically asked if the VA could take over the IVIG treatments once they got to California.
Makes sense, right? Especially with those out-of-pocket costs they were facing.
Exactly. And they were assured that there would be no gaps in their care, and they even got a referral to specialists at UCLA. They even got care set up at UCLA before they even moved.
Sounds pretty well coordinated so far.
Yeah, well, that's what it seemed like at first. They even had a VA primary care appointment scheduled soon after they got to California. But here's where things went downhill fast. When they got there, they were told they needed a VA rheumatology evaluation before they could restart the IVIG infusions.
Oh, so another hoop to jump through.
Yeah, and the PCP couldn't even submit the referral for the evaluation without those medical records. So Tucker gave them the records right away, but then those records just sat there for 2 weeks with no response.
2 weeks? Wow.
And as their infusion date passed and their symptoms started flaring up again, the VA actually suggested they fly back to Colorado for an infusion, like across the country.
Wait, seriously?
Yeah. I mean, imagine the stress of that, especially because the whole point of moving to California was to get the care they needed there.
It just shows a complete lack of understanding of what the patient's going through.
Right. And it's like they're not even trying to find a solution. They're just passing the buck.
Hmm.
So the referral for the rheumatologist did eventually get submitted, but then it was months of waiting for the actual
Oh,
appointment.
it's unbelievable.
And during this time, they ended up in the emergency room twice because of breathing problems.
Yeah.
And Tucker didn't want to be admitted to the VA hospital because they just didn't trust them at that point based on their past experiences.
I mean, can you blame them? After all they went through, why would they trust the system?
Exactly. And so after 5 long weeks without the IVIG infusion, they ended up being admitted to the hospital by the UCLA rheumatologist, who thankfully got them back on an infusion schedule through community care at UCLA.
So at least they were finally getting the treatment they needed, even if it wasn't through the VA directly.
Right. And Tucker was really proactive, working to make sure those infusions could continue under that existing community care referral, while also trying to get authorization from the new VA in California.
Trying to do everything by the book, right?
Exactly. But then on January 3rd, the VA suddenly refused to pay the coinsurance for the community care infusions. They wanted like $5,000 for past infusions and then $1,000 for every infusion going forward. And that's when Tucker discovered that the previous community care referral had been canceled back in October.
What? How is that even possible?
I know, right? And get this, it was classified as delayed, not denied, which meant there was no way to appeal it.
So they're stuck in this bureaucratic nightmare. It's like the system is designed to keep people from getting the care they need.
It really does feel that way sometimes. And even after all of this, the VA in California insisted that they could handle Tucker's needs. They even offered another evaluation to start IVIG treatment within the VA. But after everything Tucker had gone through, they just didn't trust them.
It's a matter of trust, right? When you've been let down by the system so many times, how can you believe them when they say they'll do better?
Exactly. And so, since then, Tucker's been hospitalized 4 more times because of flares. The only time they actually get the infusions is when they're admitted to the hospital. It's just a constant cycle of getting sick, going to the hospital, getting stabilized, and then repeating the whole thing over again.
It's exhausting just hearing about it. I can't imagine what Tucker's going through.
Yeah. There is one bit of good news, though. The West LA VA, with the help of Tucker's rheumatologist at UCLA, has submitted a new community care referral so that Tucker can continue treatment through UCLA. So that's something.
It's a step in the right direction, but the damage is already done. Tucker's account ends with the possibility that they might have permanent damage because of the years of misdiagnosis and delays. It makes you wonder how many other veterans are out there facing similar situations.
Yeah, it's a sobering thought. It's just a stark reminder of how crucial it is for veterans to get timely and effective care, especially for complex conditions.
Absolutely. And I think what we can take away from Tucker's experience is just how complicated it can be for veterans to navigate the system. Even when their conditions are eventually recognized as service-connected, there are so many hurdles.
It's just not right.
Yeah.
I mean, they've served our country, and this is how they're treated.
No, it's not right. And it highlights the need for better coordination of care within the VA system, especially when veterans are moving between different facilities or regions.
Yeah, there needs to be a smoother transition process. And it also raises questions about how the VA utilizes community care. Like, how can they ensure that veterans are getting the specialized care they need, even if it's not directly through the VA?
It's about making the system work for the veterans, not the other way around.
Right. It's about providing the care they deserve, not just the bare minimum. And we need to think about the financial burden this all places on veterans, too. Like, they shouldn't be going bankrupt trying to get the health care they need. So, as we wrap up our deep dive into Tucker's story, it really leaves us with a lot to think about. What can be done to address these systemic problems within the VA? What changes need to be made? What conversations need to happen? It's a complex issue, but it's one that deserves our attention.
Because at the end of the day,